Washington and Spokane voters are famously independent, voting for the person and not the party. Voters want to know the person behind the policy. Join host Sulani Madsen as she interviews 2016 general election candidates for local, state, and federal office on the experiences that have shaped their lives. The Meet the Candidate series is sponsored as a community service by the Ponderosa Republican Women's Club, the Law Office of D.C. Cronin, and We Believe, We Vote. Now, here's your host, Sulani.
Welcome to Meet the Candidate, and my guest for this session is Lynnette Vehrs, who is running for the House of Representatives in the 6th Legislative District. Welcome, Lynnette.
Yes, thank you. Thank you very much.
Well, your first question is to give you a chance to describe the responsibilities and duties of the office that you're running for.
Yes, I'll be in the House of Representatives, and it's exactly as the title says. I will be representing my constituents here in the 6th Legislative District, which is quite an interesting location up north in the South Hill, out in Cheney, Airway Heights, and Medical Lake.
Okay. So where did you grow up and start your formal education?
Born and raised in Moses Lake, and now I'm in the big city. And I went to Pullman and started my nursing degree there. What you do is you do 2 years in Pullman, 2 years here in Spokane. Mm-hmm. So I graduated in '76 with a bachelor's degree in nursing. And then later, through my career, I knew I wanted to do more. So I went back and got my master's. And at this point, now the campus is here in Spokane. So I was able to go to the campus here and get my master's and teach right there at WSU College of Nursing.
Oh, cool. And I know that you'd mentioned that you knew my mom from the Nurses Association from years ago.
She was a delight.
Thank you. So informal education is just as important. In Moses Lake, what kind of first jobs did you find for you?
One that only lasted a couple of weeks, and that was at Kentucky Fried Chicken. I realized I did not do well under pressure multitasking. But luckily, just a few weeks after that, I started my next job in Ephrata, and that was with the Public Utilities District. And that taught me some really good things about communication skills, how to get along with people, filing. So I enjoyed that. I did actually 3 summers in a row with that.
Oh, good. Yeah, those skills that you learn and just that how to be at work.
Yes.
Are kind of critical skills in itself. Yeah. So any interesting travel experiences that you bring to your position? What has helped shape you to be who you are?
One big thing was my former husband and I went to Norway. We had already 2 children, 5 and 2.5. And
the kids came along with you?
Oh, definitely. Yes.
Adventurous there.
We lived there for 2 years, and we had our 3rd daughter in Norway. And he's a registered nurse, as am I. And so we worked in the small district hospital, and it's in Lillehammer, Norway. And that was fascinating because the government was more of a democratic government and not capitalistic, and the healthcare was socialized healthcare. And it was a real eye-opener in regards to delivering care. I found it actually pretty easy.
Okay. So what, when you came back with your family and you landed in Spokane, what drew you back to the States?
Well, we left Spokane and came back to the States. Homesick. I was 2 years away. Yeah. And families and friends are so necessary in regards to raising families. And I'm very social, so I have to see my family. Yeah.
Okay. So you live now in Spokane?
Yes.
And you're working currently at WSU teaching?
No, I've retired from there about 2 years ago. I was my last job there was the director of professional development, and I really enjoyed teaching. And I probably should have stayed in the classroom, but my husband was retired, and he wanted to go traveling, and I certainly wanted to go traveling with him. So I retired, though we maintained a real active community helping schedule. So, and here I am, very active now. I think I'm working full time with this campaign.
Well, campaigns are a full-time job if you're going to do them right.
Yeah.
So what drew you towards politics? It's not something, it doesn't sound like there was politics in your background. What drew you here?
My family, they were not, I grew up in a Republican household. And after I went to Pullman, all of a sudden I got quite curious, campaigning for McGovern. That ages me. And found it really stimulating. Got involved in Equal Rights Amendment a little later, and have always kind of had my ear to politics, knowing that that's really the only game in town if we're going to be making any changes. I have always been active with the Washington State Nursing Association, and at this point I'm on the board of directors as the chairwoman of the Legislative and Health Policy Council. So that furthers my interest in politics. I've been on that council for 6 years, and one of those years I've been the chairwoman. And so we're working with a lot of policies, healthcare policies, primarily about patient safety, safety for nurses, safety for the public health. So that piqued it. Also, one of the classes that I taught at WSU that I thoroughly enjoyed was a leadership class. And in this class, I talked about being involved in politics, that we nurses, good half of our job is advocating for our clients or patients. And so I was saying getting involved in politics is another way of advocating. So after a while, I was getting kind of tired of my students coming down at the end of the lecture saying, "And Lynnette, why aren't you running?" So I decided it's time to throw my hat in.
They called you on it.
They sure did.
Okay.
Yeah.
Well, let me see. What would be another interesting question about something that has shaped your life? Is there some particular incident with a patient that has really turned you in your nursing career, focused your nursing career?
Oh, yeah. Thank you. That's a really good question, which is another motivation that I'm running. It was when I did home care nursing, and I did that for about 18 years with the Providence Visiting Nurses. Really excellent agency. And they're nonprofit. And now they're connected, with Providence. Before it was Spokane Visiting Nurses. And in my job, I would be working with a lot of insurance companies or trying to get authorization to provide care for people. I would set up discharge planning through the hospital or a nursing home, and having to work with insurance companies and appeals and trying to get a hold of them, perhaps talking to someone on the other end that's not even a healthcare provider, and having to explain why it is that the doctor and the nurse is thinking this is really a good idea, and then sometimes being denied that. It gave me an insight of actually working with the insurance companies that I found was just really disheartening. And I was actually on a committee there at the Visiting Nurses, looking at what do we do with insurance companies. In the very beginning, when this was so huge, we were working with subsidizing practically, so we could get the care that we needed to provide. And I just thought it was totally unjust and immoral that here we are trying to take care of people, and it seemed like we had a different goal than the insurance companies.
Okay. I may have to tap you for some questions for one of the insurance commissioner candidates later. So.
Oh, good.
So, well, we've come to about the last couple minutes for wrap-up. And so the direct question to you is, you tell people why they should vote for Lynnette Vehrs for the House of Representatives, 6th Legislative District.
Well, I am a registered nurse, and registered nurses have been seen through the Gallup poll for years and years and years to be the most trusted, honest, and having integrity profession there is. And I believe that is true. With all my other colleagues, I truly believe that. And working in the system, it's not self-serving as a nurse. You are there truly for the patients and making sure the patients are taken care of. That's exactly what I'll be doing for my constituents, that I will listen to what their needs are and help them out, be able to support what I can or oppose that might hurt them. And I am open. I like to make decisions that are evidence-based, not on some rhetoric or ideology. It's from evidence, research-based. So that is something I think my constituents could use.
Okay. Well, thank you, Lynnette. I'm glad you could join us today in the studio. And
thank you.
Godspeed on your campaign.
Thank you very much.
Meet the Candidate is produced in Spokane, Washington by SpokaneTalksOnline.com, which is solely responsible for its content. The Meet the Candidate series is sponsored as a community service by the Ponderosa Republican Women's Club, the Law Office of D.C. Cronin, and We Believe, We Vote. All Meet the Candidate conversations are posted on our YouTube channel, posted as a podcast on our website, and will be featured in our 24/7 live stream. Find us at SpokaneTalksOnline.com.